This morning we welcome our friends from Titusville Area Hospital. Good morning, guys. Good to see you.
Good morning. Good to see you, too.
Holli Wolfe is with us, and Holli, you brought in a special guest.
I did. This is John Hilson. He is one of our newer physical therapists at our Titusville Area Hospital Physical Therapy office located on Central Avenue. So being National Rehab Month and this coming Saturday is National Fall Prevention Awareness Day, I thought it would be perfect to talk about those things.
Sure.
So
John.
I asked John to join me.
Welcome. Good morning.
Thank you. It's nice to be here.
Tell us a little bit about yourself.
I live in Meadville. Have practiced in Meadville for the last 30-plus years.
So you're not really practicing anymore. You have it down now, right?
I'd like to think so.
Oh, okay.
He's seasoned.
Yeah, seasoned. I like that. Yeah. Had a practice there that we established, my father and I together. Dad's a retired physical therapist. Just kind of grew tired of running a business. Loved to be a physical therapist, not so much businessman. So sold the practice and have joined the group here in Titusville. And enjoying it.
Yeah.
Get to do what I like to do.
So what's changed in 30 years in your field of business?
You know, as far as physical therapy itself, we just are getting better and better. And I think the best thing to come along is what we call evidence-based practice, where we're trying to stay current with the research and provide better care for our patients. And of course, with the advent of the internet, it's so easy to access the research that there's no excuse not to be offering that better care.
Have you noticed, have techniques changed? How has technology played a role in physical therapy?
You know, we're still pretty low tech when you look at it. We have some high-tech devices, no doubt, but we
Sure.
don't rely on them like we used to because we understand exercise, movement, education really are more important as far as better patient care than a lot of the high-tech stuff.
Are people surprised when they come in and they're going through the treatment to know that you're sending them home and saying, listen, this is what you need to do at home, and you probably have the stuff at home to do this stuff?
Oh, yeah. Or we send them home with a length of rubber band, and it's good enough to be their home gym, basically. Or the importance of good posture, good sitting posture when you've got a sore back, and that sort of thing. So the technology is really in exercise, movement, and education.
Holli, from the hospital perspective, how important is it to make sure that once a patient checks in or is leaving, that if they require physical therapy, that they follow through with that?
Oh, it's very important when patients have back injuries or things like that. They may get medication or steroids or something like that, but they need that physical therapy to improve their strength a lot of times, and like John's saying, their posture, just various things like that. And while he's talking about they almost get homework, this is what you need to do to improve your health, and they need to follow through with that. If they want to get better and get stronger and get back to where they were at previous to the injury.
John, this could open up a huge conversation, and I don't mean to put you into this, but we're hearing, opioid crisis and people popping pills all the time. Talk about physical therapy's approach, and I would imagine the goal isn't to keep somebody on, unless they need the medication, but to kind of help them off of that.
Exactly. I think probably the thing that comes to mind most is back pain, low back pain, neck pain, that sort of thing. And I think we're getting better and better in caring for people that way, especially if we can see them soon after the onset. Maybe a short course of opioids for the severe pain, but if we can be effective in our management, they're off them quickly or require less pain medication, maybe just an over-the-counter product, and recover more quickly and avoid that dependence.
Coming here to Titusville, is it possible to get through the day working with people like Dan Hasbrook and others, or has it been a challenge?
Mark, when Mark, the owner of the practice, hired me, he really didn't tell me that entertainment was a fringe benefit. But Dan's entertaining. I'm enjoying working with him.
And how about the patients? Talk about what is it about what you do that you love with that relationship with the patients?
You know, I think, you know, we all want to be appreciated, right? And I think they appreciate what we do for them. So we help them, and in turn, it's a very satisfying occupation to have. You know, if we have someone who is had a total knee replacement and they hurt and they're stiff and they're weak and they're having trouble, and we guide them through that recovery process, there's obviously they're happy. They now have a well-functioning, pain-free joint, and we have the satisfaction of knowing that we've taken them through that.
Would you say that every day is different for you? Even if you had, maybe you saw 10 people that had knee issues, you could have 10 different
10 different outcomes,
yeah.
10 different approaches that we have to do. Absolutely, and I think that's a challenge. I kid my patients sometimes, and I say, you know, I think maybe I like this work because I'm like a detective, you know, and what male doesn't like to be like that?
Yeah.
Because you've got to understand a patient, understand their problem, understand what's their tolerance to pain, how active do they want to be, how much do we need to encourage them to be active. So, yeah, everybody's different. I think that's what keeps it entertaining after 30 plus years of being in the field. I'm enjoying it more now than I ever have.
You know, Holli, I would imagine when you have somebody like John and you look at his experience, you must get very excited. And we were joking off the air about Dr. Dvorkin kind of just fitting right in.
Yeah.
You know, and the experience he brings. I mean, when you see these resumes come across the desk, I mean, it has to be pretty exciting.
Oh, yeah, it is. I mean, to have someone like John here in Titusville, and he has some additional certifications. He's certified in the McKenzie method, which there's nobody, I don't believe there's anybody in Titusville that, you know, that has that certification. You know, the physicians are appreciative of that. Me personally, I don't know exactly what that entails, so maybe John could talk about that. But just to have that higher level of, you know, of certification and the different things that means for our patients is exciting.
Well, John, I'll let you explain that, and I don't mean to brag, but I have a couple certificates from the Sally Struthers School, so, I mean, try to top that.
I can't.
Okay.
Just can't do it. No, Robin McKenzie was a physical therapist from New Zealand. Actually, by accident, came across a technique to help people with neck and back pain. Really saw that he had something, and so really spread the message. It's an internationally accepted approach to treating not only now neck and back pain, but extremity problems as well. I think the nicest thing about it is there's a lot of evidence to support it. A lot of what we as healthcare practitioners do for back and neck pain, we start to wonder if we're doing the right thing. And there's a lot of evidence to support what the evaluation and treatment as described by McKenzie. And now he passed away a few years back. It's being further progressed by people that trained under him. And there's just a lot of research to support what we do. A lot of it is education, as I talked about, in self-treatment. How can we teach people to manage these problems on their own? All too often, back pain is recurrent, and so the next episode that they have, they can start their own treatment right away and understand what they need to do to take care of themselves.
And I was just going to ask you, I would imagine the folks around here are, you know, very hardworking people, right, in Northwest Pennsylvania. And we have the elements that we deal with. So you're shoveling snow or, you know, lifting heavy things. I would imagine there's a lot of neck and back issues. How often does somebody start to feel better and they go right back to doing it the same way? And they're coming back in and seeing you. Is there a follow-up with them to say, listen, if you're going to be doing this, or if this is the field you're in, here are some techniques to make sure you're taking care of yourself?
Oh, yeah, absolutely. You know, and I think they probably get real tired of hearing it from us because it's repetition, right? Every darn time they come in to see us, it's like, hey, wait a minute, you can sit better there. Or you can bend better, and we review those.
Tall. Now he's like,
And, you know, so Yeah, there's a lot of repetition, within the treatment approach, so they can just automatically go home and know what to do to take care of themselves. So yeah, we pound it into their head pretty good.
You know, and I would imagine so far we're talking about adults, but you must see a lot of students, athletes that come through. You know, they're sitting in class all day, probably poor posture, and then
Right.
going out and playing football or basketball or baseball.
Yeah, you know, that you could read some quotes from some knowledgeable people, and they say, you know, one of the worst things we do is we take our young kids and they run around and play and so on and so forth, and then we make them sit at a desk for the next 12 years. It's tough to get to that population. I mean, what kid wants to sit up straight? And oftentimes that's a, you know, kind of self-expression. Sit back in a desk and I'm pretty cool, they think,
Right.
I guess.
Or how can I lay and sleep but look awake?
Yeah, right. With good posture,
Right.
you can't do it. It doesn't work. So you don't do it. But no, we do. We see student athletes. We see, you know, young people have health issues too. You know, and I think if you look at where we're at, we're concentrating primarily sports and orthopedic injuries, and it's common in a young population. And again, we can treat them with exercise. We can treat them perhaps with some of the modalities we use: heat, cold, what have you, and education. You know, if that young person continues to have problems throwing a baseball, playing volleyball, whatever, a lot of times it's correcting form and a lot of repetition to get that to become their new habit.
10 minutes to the top of the hour. This is the Morning Drill. You're watching it on Stream Television in Armstrong and listening to it on the Allegheny News Talk Sports Network. Holly, you mentioned National Fall Prevention Awareness Day coming up.
Yeah, so that's on Saturday.
It gets one day, it doesn't get a month
I know,
or a week.
it only has one day. So we are celebrating it all next week at the office at the Titusville Hospital. Physical therapy, the outpatient office, not at the hospital, but the outpatient office, Central Avenue. So we're offering free balance assessments all next week from 9 to 11 and from 1 to 3. Patients can stop in, no appointments necessary. I shouldn't say patients. Anyone can stop in. They do not need to be a patient of the office. Anyone, general public, can stop in, get a free assessment. Doesn't take a whole lot of time, but then, you know, just to see what is your balance like? Are you at risk for a fall? And I think a lot of people would be surprised to know that maybe their balance is a little off, and, you know, maybe there's some techniques that they can be doing to improve that. So, you know, really our purpose is just to kind of educate the public and, you know, help them, and hopefully if they are at risk for a fall, that they can, you know, get some help and find out, you know, how to strengthen those muscles so they're not.
John, I would imagine that's kind of nice to see folks and just to, you know, make sure everything's okay. And I'm sure once in a while you spot something that might not be right, that might need looked at more carefully.
Oh, absolutely. Absolutely. I think if you look at some of the factors in fall prevention, one is just asking if they fall, which we will have a great opportunity to do if these folks would like to come in.
And quickly describe that. I mean, what technically is it? They just be walking and kind of fall or tripping on things, or
Well, yes to all of that. You know, if they're having balance issues, one of the things in doing a little research to come here today is blood pressure control. And if they are over-controlled, or if they experience what we call postural hypotension, a low blood pressure with changes in posture. So those folks that are controlled on their blood pressure medication, they sit on the side of their bed getting up in the morning, and they stand up to do their morning routine, their blood pressure drops and they fall. Maybe they're walking and they aren't picking their feet up high enough and they trip on a crack in the sidewalk. Maybe they have just diminished balance because they don't move much. Balance is not hardwired into our system. It's something that you develop from the time you're a newborn throughout life, and you can lose that skill, and we can help them with that. Oftentimes, I kind of refer to it as a tune-up, working on balance, work on strength, give them things to do at home to continue to improve that, and really reduce their risk for falling.
How much time should somebody set aside if they want to come in and take part in this?
You know, really, we're using an assessment tool called the Timed Up and Go. It literally takes less than a minute to administer.
Really?
It gives an estimation of their fall risk. So somebody is going to be able to come in and talk to us, and I think, as I said, we'd like to know, are they falling? You know, it's embarrassing to admit that you fall, and unless you specifically ask, they may not want to tell you. We can administer this very quick test and give them an idea that are they at increased risk for falling, and of course at increased risk therefore for injury, perhaps serious injury. And I was even surprised looking at the numbers how many fatal fall injuries there are. So it's a big problem and easy enough to help for an awful lot of folks.
So even with you guys, I know that people have a hard time talking to their doctors and saying, okay, this is where I'm having an issue here. It's almost like that game where the doctors are asking questions, trying to figure things out, and it's hard to open up, right? So it strikes me as just kind of odd with you guys that you still have issues like that where people don't open up completely to you, which if they did, it would be very helpful.
Well, and I think that's where we've got to establish that rapport. If they understand we're there to help them, we aren't going to tell on them or whatever they've thought in their mind that the adverse effects of talking about their falling are, we gain their trust, and it works out pretty well.
So, Holly, once again, you guys will be doing this next week.
Yes, next week, Monday through Friday, 9 to 11, they can stop in, and then again in the afternoon from 1 to 3. So walk-ins are welcome, and we're happy to see as many people that we can get in.
All right. Before we wrap things up, Holly, what are some other things you guys are working on up at the hospital?
Well, next month is National Breast Cancer Awareness Month. As a former mammographer, it's a passion of mine, so I'm always excited to talk about that. We are getting a new 3D mammography machine installed next month at the hospital, so more to come about that, but that's really exciting for everybody, just to be ahead of technology and to be able to offer the best techniques and the best mammogram that we possibly can at the hospital is really exciting.
That's wonderful.
Yeah.
Talk a little bit about the intensive care unit.
Yeah, so we're kind of rebranding our intensive care unit. It's the transitional unit, and we're doing a lot more with it. There's just such a need, the things that we can do there. It really sets us apart from a skilled facility or something like that. We have the physicians there, which maybe a skilled facility doesn't. So a patient comes in and they're at the hospital for a couple of days. It's really a benefit for them or their family members, possibly, if they qualify to stay at the hospital for an extended care, which would be for the intensive transitional care program. And of course, we have physical therapists, occupational therapists, speech therapists there that would work with them. So it's a great thing, and then they would transition to our outpatient office, which Dawn works at. So it's just all around great. Our therapists then get to know these patients while they're in the hospital, and then they transition to the outpatient office, and it's a really, really great program. Like I said, we have the physicians right there if they're needed. All of our staff, pharmacy, and everybody is right there. So, it's for the patients that aren't quite ready to go home yet, or maybe, the family is not able to kind of help them at home, and they're just worried about their transition home. So a lot of patients do qualify for the program. They just aren't aware of it, or some patients are like, I'd rather go home. But then again, you're at risk of falling. So, getting them in and into our program, and really it's just you're still in the same bed. It's, people think that you're on a different floor or something like that, but you're really still in the same room, have the same nurses that you already know and trust, and it's just a great thing to try to get our patients stronger before they go home.
John, does it surprise you at the level of care that Meadville Medical Center, Titusville Area Hospital is providing to the communities they serve?
I guess I'd say no, only because I've gotten used to it. I mean, I think we're extremely fortunate. I think now with a new orthopedic surgeon coming to town, I think with the transitional care that's available, you can stay right here in Titusville, have your knee replacement, hip replacement, have your orthopedic procedure if you need that level of care, straight from the nursing floor to the transitional care to outpatient rehab. That's good stuff.
You get it all.
Yeah.
Nice meeting you this morning, John. Great to have you on. Holly, great to see you, and we'll look forward to seeing you next month.
Sounds good.
John, what'd you learn today?
I've learned what a vibrant community Titusville is. Not just in talking with you and learning more about the hospital and what it has to offer, but just being here. I guess it's not learning just today, but
sure.
It's a nice community. It's a nice place to work and to experience.
Holly, did you learn anything?
I learned that I need to improve my posture a little bit.
Yeah, I know.
Right?
We're all sitting up. Hey, have a great Wednesday.
Thank you.